Hey guys, my name is Dr. David Midoff, physical therapist and owner of Paso Manual Physical Therapy. And I wanted to answer a few questions that we commonly get asked. One of them is, what's the difference between manual physical therapy and just normal, regular physical therapy? And it's a good difference, actually. If you've never heard of a manual therapist or a manual physical therapist, one of the main differences is that we're highly trained. It's a lot more training we have to go through, and we know a lot of hands-on manual type skills. It's not just that though, it's a lot of advanced exercise and movement knowledge that we have as well. Using these advanced hands-on techniques and movement and exercise techniques, we can get patients better way faster compared to a regular physical therapist. Now, to be a physical therapist nowadays, you have to have a doctorate degree. There's still PTs out there practicing that have master's and bachelor's degrees as well. But to get a manual therapy certification, you need to go through an additional 3 to 5 years of training beyond your typical PT degree. So somebody who's a manual therapist has a lot more training. That's how they've gotten all those advanced skills and techniques. So the other question that we commonly get is, can manual physical therapy help back pain, knee pain, shoulder pain, neck pain? And the answer is absolutely. Those are the best things that we help people out with. The main difference is, compared to regular physical therapy, a manual therapist, somebody like me, can help you get way better, way faster. So we do it in fewer visits. Usually we'll see people for less visits, and sometimes we can even cut down the total amount of time at which you can recover. Really, what I tell people, the main limiting factor in recovery time is how long the body takes to heal. And it just depends on the tissue, because if you've got a disc problem in your neck or in your back, anywhere in the spine, discs just heal really slow. There's not much we can do to make it go faster, as long as you're taking care of, the strength, the amount of joint motion you have, all the other factors that you can control. Then the disc is just going to take about a year to heal. Versus a muscle or tendon or ligament injury, those take different times of different amounts of time to heal as well. So that's the biggest limiting factor, but we do cut down the amount of time of visits and total time of treatment most of the time. One of the most common questions we get is, can we help avoid surgery for something like a rotator cuff problem, like a rotator cuff tear? And absolutely, that's what we do all the time. We help people avoid surgery, get off of painkillers if you're taking painkillers all the time. You don't want those chemicals in your body long term. I mean, if you're in pain and you need them, that's cool for a short period of time, but eventually you want to get off pain medications, whether that's ones that you're taking in your mouth, orally, or injected pain medication, like if you get a steroid injection or something like that. You want to be as natural as possible, and that's what we offer. We offer a completely natural solution. We're using exercises, hands-on techniques. There's no injections, no sort of medications. That's what you see the doctor for, of course. So we help people to get to the point where they feel pretty confident in returning to the activities that they couldn't do before, because of the pain they're dealing with, whether it's a rotator cuff problem or a knee problem, ankle, hip, back problem. Those are the types of things that we help all the time. And then finally, the last question that we get all the time, and people tend to ask us this in passing, like on the phone, or they bump into us, and it's kind of a loaded question. They'll say, hey, do you have any stretches or exercises that I can do right now to help out my neck problem, or my shoulder problem, or back problem? And the answer is, yes, we've got exercises, but we need to check you out first. In order to be able to give you the right thing so that we know that it's going to help you and not hurt you, not set you back, it's best if we set up a time where we take a look at things, test out the strength, test out the joints, test out the nerves, test out everything that could possibly be contributing to your pain, so that then we can give you the right things to do. And it might be an exercise, it might not. If you already exercise, it could be that we just need to tweak the way that you're doing it. So it's not a good idea to just say, oh yeah, here, do this exercise. It's not something that we can do in passing. So if you have questions, if you want to know more, give us a call. You can reach us at 915-503-1314. You can talk to Bob and Vicky as well. They have our contact information, and we'd love to talk to you more about what's going on with you and just see what you've done, see what we can help you out with. Thanks so much, guys. Have a wonderful day.